Welcome to AETCM, the Emergency Medicine channel. So today I will be discussing about zipper injury, which is one of the most common presentations in ER, especially in pediatric age group. So coming to the anatomy of penis, actually we have the most common site where the zipper injury occurs is at the foreskin, at the prepuce, foreskin or prepuce. At this level is where the zipper gets stuck, and mostly seen in uncircumcised pediatric age group patients. And also it can also involve the glans penis or the shaft also in other rare cases. Then the distribution of, just to say about the arteries and nerves and veins, centrally will be the veins of the penis present. It is located dorsally, which is the superficial and deep dorsal vein. Then towards the sides will be dorsal artery and dorsal nerve. At the lateral end will be the dorsal nerve. So usually these patients we can initially start with giving analgesics. So we can either give oral analgesics, IV analgesics, or we can give like local anesthetic. So local anesthetic we can use lignocaine or bupivacaine. So lignocaine usually will give 1% lignocaine or 2% lignocaine will take in a
before
syringe.
that, can you just tell about the nerves, where the location is?
Yeah, it is. So we have discussed already. The dorsal vein is usually located centrally, the superficial and deep dorsal vein. Lateral to the vein will be the artery, which is the dorsal artery located here, and lateral to that will be dorsal nerve. Around it will be in the 1 o'clock position or the 11 o'clock position on either sides. So that is deeper to the buck fascia.
1 o'clock position. This is 1 o'clock position.
1 o'clock position, and this is the 11 o'clock position. This is the usual position, and it's deeper to the buck's fascia. Yeah. Okay, so we can do it two ways. We can either give it as a local anesthesia by locally infiltrating lignocaine, or we can give bupivacaine.
Okay. So before going to the block specifically, can you just mention about the anatomy of the zipper and the types of injuries?
So the zipper basically contains sliding tab or the sliding piece. So we can it's used as a hand grip. So this part is the sliding tab of the fastener, and we have two plates, which is the outer. This one is the outer face plate, and the deeper one is the inner face plate. So we have two face plates, and both are united at the center by median bar. So it is held together with the median bar. So this is the median bar is what we use mainly to remove or release the zipper. So that part also we should know. It's just a central. This part is the median bar, and yeah. And okay, and we have two types of injuries. Basically, either it can get the prepuce or the foreskin can get stuck in between the teeth, or it's called as dentitions. So it can either be caught between the dentitions, the teeth which interlocks together in the zipper mechanism. So either it can get locked in the between the teeth, or it can get involved or locked involving the fastener. The fastener is the whole block is called fastener, and this is the dentitions. So it can either get involved in both dentitions as well as the fastener. So that mechanism of removal is also release is also different. So these two are the most commonly involved sites. Then local infiltration, as we said, lignocaine.
So first, if a patient comes and if the patient is having severe pain, so this is injection. So other than injections, do you have any other way to?
We can give oral analgesics can be given, or IV analgesics we can give, paracetamol we can give, or opioids we can give, or mild procedural sedations also we can give. The patient is anxious or not cooperating for the procedure, mild procedural sedation can be given.
Okay, so usually, can you take that some slide? Okay. So usually we have if the child will be in severe pain and anxiety. So in order to reduce the pain, and if the child is not cooperating for IV cannula and all, then it will be difficult for us. So one way is to reduce by giving some local application. So what can be given as a local application?
So we can give lignocaine or lidocaine, or bupivacaine can be given. So 1 to 2% concentrated lidocaine we can take, and we can take it in a syringe, 5 cc syringe.
Not as an injection. You can give some creams. You can use
lignocaine gel.
lignocaine gel can be used. So
Can
we
be
have 2% lignocaine gel
lignocaine
that
gel.
can be used, or you can use lidocaine with prilocaine cream can be
Cream.
used. That EMLA cream can be used. So first, always, if the child is not cooperating, always plan for a local anesthetic or something. So you 2% lidocaine or 1% lidocaine can be used, or just lidocaine liposomal lidocaine can be used, or this EMLA cream. EMLA cream contains lidocaine with prilocaine can be used. So that can reduce the pain. Then any other ways to reduce the pain?
Then we can give dorsal nerve block can be given, penile nerve block.
Before nerve block, anything else? So dorsal nerve block is an injection. If you are giving IV, that is also IV analgesic, that is also an injection. So any other way to calm the child to reduce the pain little bit? So this is one way. Then second way is we can use the spray. So we have lignocaine spray. What is the concentration of lignocaine spray? Our spray comes as 10%. 10% lignocaine spray. That can be, so each puff will contain 10 mg. So if so the concentration is more, so with each puff the amount of spray coming is more. So it also doesn't contain adrenaline. So if you are spraying to that region also, that will cause some analgesic effect. Then other method is by applying mineral oil. Mineral oil can reduce the pain, but the problem is that oil should be applied for 10 to 15 minutes. That much drops are required. Then comes to the then other methods are for the procedural sedation, as you told. You can use opioids like intranasal fentanyl, like that can be used, intranasal fentanyl. So these are the non-invasive things. Okay. Then we can place IV cannula and give injections, paracetamol what are required, and then other method is the dorsal nerve block. Okay, you can tell.
Okay, so after local infiltration, if it does not
so
work,
we use 1% lignocaine. What is the dose? 1%
lignocaine. Usually we can take lidocaine. We can use. We can take 1 to 3 ml in a syringe. Maximum dose we can give is 5 mg per kg, or 0.5 ml per kg is maximum dose we can give.
Anything else?
And bupivacaine also 0.25% solution we can use, around maximum dose of 2 mg per kg can be given.
Okay.
So that the location where we have to inject is important. So ideally we can do it blind, or we can do it as ultrasound guided. So ideally we have to do it as USG guided to prevent any arterial puncture. So here the location is at the base of the penis and the suprapubic skin. So the area between that will be our puncture site. So the clockwise position will be around 10 o'clock is where we will be injecting, and here it will be around 2 o'clock.
So the nerve is at 1 o'clock and 11 o'clock position. We will insert
at 10 o'clock and 2 o'clock position. So first of all, we will insert around 3 mm depth we can take for injecting, and we will know when we reach the location, we will get a pop effect we will get, because the buccal fascia is pierced. So once the buccal fascia is pierced, we will get that pop effect, and then we can withdraw the syringe, and we can see if there is any arterial flashback, any backflow is there. If nothing is there, then we can inject around 1 ml to 3 ml of the lignocaine solution can be injected.
Okay.
And you have to repeat it over the other side as well.
Okay.
So that is the dorsal penile nerve block we can give in this situation. Then coming to, based on the injury, like how will we proceed further. So once we have given the adequate analgesia or sedation, depending on the situation, or the local anesthesia or the sprays or the cream, we can proceed further. So first we will try.
How much time should you wait after the dorsal nerve block for the analgesic action?
Around 5 minutes.
5 to 10 minutes.
5 to 10 minutes.
But if you are using something like a mineral oil and all, it will take some
10 to 15 minutes. It will usually take.
And if it is cream and all, the time of absorption and action will get delayed.
So first of all, we will try with the non-invasive procedures. So first of all, we have already discussed about mineral oil. So if there is minimal skin involvement, then we can try initially with mineral oil, and we can give gentle traction. So based on wherever it's involved, we'll just apply the mineral oil over the skin of the prepuce, and we'll try to just give a gentle traction and try to unzip the zipper. And if it doesn't, we should not give more force, because it can lead to swelling and bruising. Further bruisings can abrasions can occur. So that heavy traction should be avoided. Only gentle traction we have to give with the mineral oil. Now,
And
if that fails,
if we are seeing lot of edema and swelling,
then we should not proceed, because it will again our other next procedures will be difficult. So after that, the next step we can do is based on where the zipper has got where the prepuce is stuck in the zipper. So if the prepuce is stuck at the level of the dentitions or the teeth level and not involving the fastener, then we can actually first of all remove the remaining clothing around the zip.
Okay.
And
First
then
remove this clothing. This clothing should be cut
off. And after that we can put cuts over the in between the zippers. So like these cuts we can keep in between the zippers and then give lateral traction either with our hand, or we can use any forceps or tooth holding forceps we can use and try to pull laterally. So that should release the skin. So that is one method if the skin is prepuce is stuck between the teeth. The other one is the most commonly seen. So in that usually it will be at the level of the fastener and also can involve some part of the teeth as well. So in this what we do is as we told, what unites the outer faceplate and inner faceplate is a median bar. So what we do is we cut the median bar using any wire cutting or any bone cutters. Wire cutters or bone cutters are usually bone cutters we have available. So we can use the bone cutters as shown in the image here. We can cut the median bar using the bone cutters. And so once the bone cutter is cut off, we can separate. Once this is cut off, we can separate the outer and inner plate and then separate the teeth as well. That is one mechanism. Otherwise, we can even use the ring cutter, can also be tried to cut through that part. Another method is using a screwdriver. If we have a flat edged or a flat head of the screwdriver is present with thin blade, then and if one side of the skin is involved in between the plates, if it is involved here, if the skin is prepuce is involved here and this side is free, then we can try another method with the screwdriver, which is using the flat end. We insert it up to the median bar. Once it reaches the median bar, we will start rotating it. So once we rotate it, it will start to widen. So once it widens, we will be able to detach and remove the zipper. So that mechanism also can be tried. So here there is a child with involving the fastener, and as well as the fastener is involved in this mainly. So here we will just cut off the median bar, and after that it was released, and it shows the abrasion. That's the main methods usually used. And after this thing, removal of the zipper, there is any abrasions and all, we can, based on the tetanus toxoid vaccination status, we can give tetanus toxoid according to the guideline, or we can also apply any antibiotic ointment based on the abrasions. And we should also inspect for any urethral injury. If there is any urethral injury, we have to further give consultation for urology for further exploration. And also we have to advise or give advice to the mother or the bystander regarding the painful urination. They will have painful urination for the next 2 to 3 days. So they can either use some warm bath and urinate during those episodes.
Okay.
And also to apply the antibiotic ointment. There is obvious aberration.
And most importantly, advice regarding the use of undergarments to prevent such injuries in the future. So can you just summarize the types of zipper injury and how to remove?
So first of all, we have talked about the most common site of injury is the prepuce or the foreskin. That is the most commonly involved site. And if based on that, once the child presents, we'll have to either give analgesic, proper analgesics, or pain relief has to be done. So that is done initially either with oral analgesics or IV analgesics or procedural sedation, or we can use non-invasive methods like lignocaine cream or lignocaine prilocaine combination creams, or we can use lignocaine sprays, 10% lignocaine sprays, or we can use if that also doesn't work, then we can use local infiltration with 1 or 2% lidocaine, or we can use bupivacaine 0.25%. So if that also doesn't work out, then we can try with dorsal penile nerve blocks can be tried. And after that, if that doesn't work, then we can use the IV analgesics or procedural sedation. So once adequate analgesia has been obtained, we will proceed with where the site of the proprius involvement is there. Is it at the level of the teeth, or is it at the level of the fastener? So based on that, if it's at the level of the teeth, we'll have to cut the remaining clothing and cut between the teeth and then pull apart. Lateral traction has to be applied. Or else if it involves the fastener, then we'll have to either use the bone cutters or wire cutter and cut it at the level of the median bar and pull apart the face plates. Or we can also try using the screwdriver if one side is only involved, and we are able to insert the screwdriver end and rotate it and widen the gap. So these two methods, and further wound management also we have to do. We have to give TT if required, and also the abrasion is if abrasions are there, we can give an antibiotic ointment, and we can send off.
Okay, thank you.